Good afternoon, everyone. I'm Diana Rauner, the president of Start Early and co-chair of the Early Years Climate Action Task Force. Thank you very much for joining the first public listening session of the Early Years Climate Action Task Force. This task force is charged with drafting the first ever Early Years Climate Action Plan for the United States. The task force will identify best practices for government, child-serving systems, businesses, not-for-profits, and philanthropy to mitigate, adapt, and respond to climate change as it relates to young children and their families. It will also develop policy frameworks for implementation at all levels of government. The task force will hold a series of listening sessions. This is the first, highlighting the particular vulnerabilities of young children to climate change and opportunities for the early years sector and the climate sector to participate in and change opportunities for action. It will hear from parents and guardians, children, caregivers, pediatric health providers, subject matter experts, and grassroots advocates. The task force's work will also highlight the experiences of Indigenous and Native American communities, people of color, those on low incomes, and those living in particularly climate vulnerable communities. Now I'd like to pass things over to my co-chair, Antoine Ford.
Thank you, Diana. How are you? Again, my name is Antoine Ford. Good afternoon or good morning to wherever you are. I'm Antoine Ford. I'm president and CEO of Enlighten Incorporated, but also work in the chair of the board for the DC Workforce Investment Council and secretary of the National Association of Workforce Boards. Today, we have a great panel to help us understand why we should have early years sector move towards climate action and how climate change impact early childhood development. This is a moment of unprecedented investment in clean energy, infrastructure, and other strategies to meet our obligations to the future. Our work as a task force presents an opportunity to make sure the needs of young children and their families and communities are at the forefront of climate action at all levels of government across the United States. We will hear from each panelist first and then ask task force members to be able to ask questions. We really encourage you to participate. We are joined by to introduce some of our panelists, and then I'll turn it back over to my co-chair. Ann Lombardi is a senior scholar at the Center for Child and Human Development and a senior fellow with the Collaborative on Global Children's Issues at Georgetown University. I wish it had been GW where I want, but I like Georgetown too. Over the past years, Joan has made significant contributions in the area of child and family policies as an innovative leader and a policy advisor to national and international organizations and foundations as a public servant. We also have Erin Bernstein is the interim director of the Center for Climate Health and Global Environment at Harvard T.H. Chan School of Public Health. Is also a pediatrician at Boston Children's Hospital and an assistant professor at pediatrics at Harvard Medical School. Dr. Bernstein focuses on the health impacts of climate crises on children's health and advancing solutions to address its cause to improve the health and well-being of children around the world. Diane, do you want to introduce our other panelists?
Thanks, Antoine. I'll continue with Jacqueline Patterson, the founder and executive director of the Chisholm Legacy Project, a resource hub for Black frontline climate justice leadership. The mission of the Chisholm Legacy Project is rooted in a just transition framework, serving as a vehicle to connect Black communities on the front lines of climate justice with the resources to actualize visions. Prior to the launch of the Chisholm Legacy Project, Patterson served as the senior director of the NAACP Environmental and Climate Justice Program for over a decade. During her tenure, she founded and implemented a robust portfolio, which included serving the state and local leadership whose constituencies consisted of hundreds of communities on the front lines of environmental injustice. She also led a team in designing and implementing a portfolio to support political education and organizing work executed by NAACP branches, chapters, and state conferences. Lawrence Chandy was appointed as UNICEF's first director of the Office of Global Insight and Policy in August 2019. He previously served as UNICEF's director of data research and policy, a position he held from 2017. Mr. Chandy came to UNICEF from the Brookings Institution, where for 7 years he was a fellow in the Global Economy and Development Program. There, he conducted research on global poverty, fragile states, aid effectiveness, and globalization. His work, including through his membership in the Atkinson's Commission on Global Poverty, shaped reforms on global poverty measurement and helped make the case for establishing the goal to end extreme poverty by 2030. And finally, Luz Drada is a program coordinator for Moms Clean Air Force. She has had an interest in sustainability and the common good throughout her career. After becoming a mother, she became aware of the climate crisis and the impacts of climate change and air pollution on children's development. Thank you all for joining us here today, and we will begin with Joan.
Thank you, Diana, and thanks to Antoine and the organizers, the task force members, and all of you who are participating. It's an honor to be asked to make some very brief remarks before you hear from this excellent panel about why it's so important for the early childhood field, a community that I love, why we should be involved in climate action and environmental justice. I've had a 50-year focus on young children. The scientific evidence and common sense have provided us the answers to these things all along. But recent events from Puerto Rico to Pakistan, from Flint to Jackson, have really been a wake-up call. These events, along with the pioneering work of early childhood advocates around the world, have helped galvanize action. There are many reasons why we should be involved. Let me just state 3: vulnerability, solutions, and opportunity. First, the developing child is the most vulnerable to environmental degradation and climate change. The impact of air pollution, drought, heat, lack of access to clean water. Young children bear the biggest burden, despite the fact that they have the least responsibility for causing it. Particularly true for children in low-income countries and communities here that have had a history of racial discrimination. Every aspect of nurturing care, health, nutrition, access to early learning, safety and security, even a parent's ability to be responsive, is impacted by environmental factors. So the bottom line, environmental issues affect the trajectory of child development, and that's the first reason that we have to be involved. Second, our work in early childhood is a critical part of the solution. It's been said that children are not just vulnerable, but they're valuable. Supporting healthy development is a pathway to a different future, a pathway to a world that is more sustainable. When we grow healthy children, we're building their resilience and their adaptability to changes that they will inevitably see. Across our work with parents, with children, and with community system building, we're part of the solution. We support parents impacted by the environment. We help them respond. We help them prepare. We help them cope. We provide them hope. We can even connect them to green jobs, to better jobs. We support children by creating a generation that values the earth, that encourages them to disconnect from devices, at least sometimes, and connects them with the joy of nature. We support communities in moving to a more green environment. So I want to acknowledge that this issue is coming at a very difficult time for our field. The stress of COVID, the lack of public investments. We have to acknowledge that the capacity of the field is strained, but that's exactly why my last reason for us to be involved is that it's an opportunity for us to build new champions with environmental activists, with youth activists who are such a hope and inspiration, and for elderly activists that are concerned about the future of their grandchildren. In all these years, I've never felt such a sense of urgency coming at such a difficult time. But we plant seeds, we teach curiosity, we understand persistence, we get things done. We have to be involved. Equity and justice is part of the early childhood mission. We don't have to be experts on climate. We do have to help build awareness of what's at stake for children. We do need to understand the impact of not acting. We do need to be seen as part of the solution in partnership with others. This is not someone else's issue. It's our issue because it's a child rights issue. Every child has a right to a future, to live every day in a clean and healthy environment, from Nairobi to New York, from Dhaka to Detroit. I want to thank the task force members and all of you for listening. It's really a wake-up call for all of us.
Thank you, Joan. We'll now hear from Aaron Bernstein.
Thank you so much. And what an honor to be here. And I feel I should take out a new policy, which is never to speak after Joan Lombardi, because there's not much left to say, is there? This is an extraordinary occasion to see folks in the early childhood world engage in climate in a full-voiced way, with an opportunity to really do something that I think has really evaded our decision makers for a long time, which is to put children first in this context. I'm a pediatrician and a dad. I've been working at the intersection of climate and health for over 20 years. And at the root cause of I think, even our best efforts on climate is the lack of appreciation for the reality that the real measure of progress on climate change is our children. Whether it comes to the policies that govern air quality, how we make decisions about our food systems and transportation systems, and this is as true in our country as anywhere, we fundamentally designed the field to favor adults, and that's under the belief that if the adults do well, the children will be okay. And that sort of worked for the 20th century. But with a problem like climate change, it actually is a surefire way to make sure that our children don't have the world that we would want for ourselves as children. And so I think at a broad level, this activity is critical because it's one of the very few that I know of that is squarely focused on what is the root cause, in my view, problem with policymaking around climate, which is that children are discounted. And in fact, children cannot be discounted. And that's true for everyone. If we want the adults to be okay, we actually need to put children first here. And I know I'm very much speaking to the chorus when I say that we can do that in a lot of arenas, not just this one. Now, I was asked specifically to address the intersection of climate and child development, and I think that underscores the point I was just making. So there's research, which many of you may be familiar with, showing that a child born in the world in 2020 will experience many times, depending upon where you are on the planet, 4, 6, 8, in some cases, depending upon the kind of climate shock, multiples of that, times the number of extreme events in their lifespan as someone born in 1960. Let me just underscore that. So a child born in the world in 2020 is probably 4 times likely to experience a life-threatening heat wave, a hurricane, a fire, a flood, a drought, a food shortage because of climate change, than a child born in 1960. And as we move forward in the century, that intergenerational inequity will grow. So we can't simply base our decisions about value on current circumstances because we already discount children in the present, but moving forward, the inequity is yet greater. So that's one point. Another critical point is what climate change does to the developing mind and body. So there is a generation of research that has painfully shown us that we have so much at stake. And again, I know you all know this stuff backwards and forwards, in making sure that children are protected from the adverse childhood events that are always a part of childhood. Sadly, no child really makes it through life as a child without one. But we know that what needs to be deployed to buffer that those adverse events, to prevent what many call toxic stress. Climate change is really like it is adverse childhood events on steroids. Children, if you ask a child to draw their family in say the 1st or the 2nd grade, they will draw figures of the people who live with them, and they will almost certainly draw a picture of their home or where they live. And that's because a child's identity is so squarely based in this home environment. Now, of course, not all children are so fortunate to have that, but those that do will do that. And so it's not surprising that when a child's home is destroyed by fire, by flood, if a child is forced to move because their family can't afford utility bills. This is another well-studied area of child development, that housing insecurity is a major contributor to both, of course, health outcomes tied to utility costs. That these events really shape a developing brain that really brings out the weaknesses that are embedded in each and one of every brain ever created on this planet. So all of our brains are vulnerable to mental health disorders, to addictions, and these adverse childhood events essentially shape the developing brain in ways that make these tendencies come out. And so we see decades after children are exposed to these events, unbelievable disparities in health outcomes, and not just in things like substance abuse and sexually transmitted diseases and mental health disorders, but in cancers and heart disease. And so we need to be clear that we can't really talk about healthy child development in the absence of climate change, nor for that matter can we talk about health equity without talking about climate change. Health equity requires climate action. It's not a maybe. It's not a, and I think that these are the kinds of issues that this task force is uniquely well positioned to put in front of policymakers, because I can tell you, having done this for a while, children are not often presented, if any, even in things like the Clean Air Act in the United States, which is an amazing example of success. Child health is included mostly in the form of asthma and sort of there, but no other value of child welfare, even from all of the research we have, showing that air pollution, which of course is just one very small wedge of this issue, has dramatic effects on childhood. So I hope that underscores the value of this task force, and what Joan so eloquently put before me about why children are so important to focus on. We have to put children, the value they bring to our lives and our world, the fact that they have much more at stake, and that there are very real, tangible effects of climate on child development that are really going to roll back, and already have in many communities, the amazing progress that's been made in early childhood development, and really delighted again to have the opportunity to be with you.
Thank you, Aaron. I think what you said, there was an aha moment when you said that children are discounted. One thing that climate and the early childhood field have in common is that in the future is discounted in our public policy, and that's pretty clearly happening in both sectors. Next, we'll hear from Jacqueline Patterson.
Thank you so much. Yeah, so it's an honor to be here with you all, and it is such a topic that fills one with angst and sadness, but also with hope and some of the solutions that we will hopefully be talking a lot more about. And it's, if anyone can advance the solutions that we need, it is folks on this task force. So excited to be a part of this conversation. So we put out a report earlier this year called The Racism That Upends the Cradle, 25 ways that Black children are disproportionately vulnerable to the kind of converging crises of climate change, COVID-19, and the economic crisis. And so in it, we really detailed particularly the ways that Black children are impacted by climate change and the entire climate change continuum. And already Dr. Bernstein gave some of those factors. And when we talk about the entire climate change continuum, it is from the drivers of climate change and the toxic practices that impact the health and well-being of communities. And it's not just Black communities, I should also say, Black communities and BIPOC communities in general, Black, Indigenous, and people of color communities. And the work that we do is focused on Black children, but definitely I'll make some references to where there's overlap with other BIPOC communities as well. And so whether it is the toxic facilities, from the fact that oil and gas facilities, coal-fired power plants, near roadway air pollution, incinerators are all disproportionately located in BIPOC communities, and particularly Black communities, that results in the higher risks of particle pollution, carbon dioxide, nitrogen oxide, sulfur dioxide, all these different toxins that are impacting the health and well-being of children. One of the statistics that one hears the most is around asthma, and that Black children are 4 times more likely to be hospitalized for asthma attack and 10 times more likely to die of an asthma attack than white children. And so also I want to back up a minute and say that some of the historic issues stemming from when Black folks were brought over to be the enslaved labor for this nation formed the foundation for where we are today in terms of both the lives not being valued. And this is why you hear of this kind of call for Black lives to matter, because of the dehumanization and lack of valuing of lives. And then some of the structural ways that plays out, from redlining and segregation and so forth, that still goes on today. And so we have our communities are more likely to be in the shadows of these toxic processes that result in pollution, to the fact that we're more likely to have these food insecure communities, as was referenced before, more likely to have homes in floodplains, more likely to suffer housing insecurity and displacement. And so all of this directly overlaps with the vulnerabilities that make one more subject to the impacts of climate change. Lack of economic mobility is directly, unfortunately, even tied to the extent to which one is represented in a democracy, because of those economic challenges then result in the lack of political power. And so we know that Black children are born in the top 5th of income distribution only have an 18% of chance of staying there into adulthood. So the lack of being able to even maintain, much less even to advance in economic mobility, is a chance, while is an issue. While white counterpart children have a 41% chance of staying in their same economic strata. So this is where you start to see some of these challenges. That in going back to the segregation and redlining, we know that Black people are 40% more likely than other groups to currently live in places where extreme temperature driven by climate change will result in higher mortality rates. And so that's not just being even born into those situations, but even there are reports that came out earlier this year about urban heat and maternal mortality. So being able to actually survive through childbirth is challenged by where a lot of Black children and Black families live. We know that shifts in agricultural yields is one of the impacts of climate change, and that Black American households face hunger at a rate more than twice that of white and non-Hispanic households or non-Latino households. Getting enough to eat is a constant struggle for 1 in 4 African American children, and again, only exacerbated by the shifts in agricultural yields that result from climate change. We know that water scarcity is one of the challenges that is already happening and will continue to happen in the context of climate change. And we also know that that Black children are more likely to live in communities that have polluted water. We see that Jackson is in the headlines, but that's just the headlines. They're all the places where there's an invisible daily disaster of lack of water in many, many communities. So in my waning 30 seconds, I will also say that another challenge is that with the U.S. being 4% of the global population, I mean, yes, with the U.S. being 4% of the global population, but 25% of the emissions that drive climate change, we're directly responsible for the fact that many nations have becoming uninhabitable for folks in the global South. And yet when people are immigrating to come here, then people are put in cages or greeted by officials on horsebacks using their reins as whips. And it's Black children, Latino children that are suffering under that kind of greeting. And so And I'll wrap with talking about the disproportionate impact of climate change and climate grief on children, because given that there is this heightened level of loss that's happening, that stress and anxiety disproportionately impacts children in general, and Black children, because of the impacts, are more. So those are just laying out some of the why, and I look forward to the further question and conversation about the what we need to do about these impacts. And again, you all are the folks that we need to be having this conversation with and leading on the solutions. So thank you. I'll hand it back.
Thank you so much. I want to remind our task force members that you can put your questions in the chat, and that is moderated, and we will have conversation and questions after each of the presenters speak. Lawrence Chandy is next.
All right. Thank you, Diane, and thank you, Antoine. It's a real honor to be here. I want to convey 4 points to colleagues today. So the first one is that climate change is going to affect all children's lives. Last year, some very smart colleagues of mine at UNICEF conducted a mapping exercise where they looked at available data on where climate hazards are expected to hit and where children live around the world today, to understand how many children, what share of children are exposed to different climate hazards. They were looking there at heat waves, at cyclones, at air pollution, at flooding, water scarcity, vector-borne diseases. And what they found is that more than 99% of children are exposed to at least one of these climate hazards or stresses. So this is not a minority issue. This is an issue that will affect all children. They also found that more than 2/3 of children around the world, so 1.7 billion children, are exposed to at least 3 of these climate stresses or hazards. So that's my first point. My second point is that in a climate era, the strategies we pursue in pursuit of social policy or economic development are going to have to radically change. What we're seeing in those big numbers I cited earlier is what I would describe as this sort of fundamental evolution in that core challenge of social policy and economic development. Historically, we've really thought about those challenges as one about deprivation. There are children around the world who lack food, education, healthcare, and the challenge is to equip them by their families, by their communities, with the means to provide those for them. But today, the challenge is increasingly one about insecurity. So we've entered this era where shocks, whether localized or global in nature, are becoming more frequent and more intense. And climate change is clearly a major driver of this. And we see this very starkly in the data. So I, in a former life, when I was at Brookings, I did a lot of work on global poverty measurement. And I spent a lot of time drawing the same chart over and over again, which was a very happy chart showing the share of people in the world living in extreme poverty. And it's been trending down for years and years. But what we're now seeing is while that trend continues to go down, albeit at a slightly slower pace than the past, the share of people in the world who are in food insecurity, that's people who have to go without meals for a day, is trending up. The share of people who require life-saving humanitarian support, that's going up too. And when you see this chart, when you see these lines heading in different directions, when you first see it, you think this can't be right. There's got to be some kind of, we're measuring something wrong here. But it's perfectly plausible that these two things are happening at the same time. So this sort of shift from deprivation to one of insecurity. And I'd argue that we're going to start to see something similar happening in the US, in the sense that who we need to target with our support and how we design interventions is going to have to change as insecurity becomes the core challenge of social policy and economic development. My third point of 4 is that we should be especially concerned about children facing shocks in their early years. So I've made the point that insecurity is the key issue of our time, but we should be especially concerned about insecurity in those early years. So, I think we all know on this call, but children's early years, they're the formative years. It's a time when the brain is developing. We've already heard about the particular challenge of high levels of toxic stress being especially harmful to children. This is a time when nutrition and stimulation are key. And it's the time most in life when timing matters. Investments in early years were first sold as a smart investment because of their large returns that play out over individuals' lives. They've also been sold as the great equalizer. If you invest in early years, it's an investment in equal opportunity. Now, I would argue an investment in early years is an investment in resilience. It's shielding people from the shocks they'll face at the most vulnerable time in their lives. And the fourth and last point I want to convey today is that countries around the world are slowly waking up to this reality. There's a forthcoming study from UNICEF, which I think we're going to release shortly before the next COP meeting, which reviews the NDCs, the nationally determined contributions of countries around the world. This is where countries assess their contribution to the Paris Accords. And what we do in this report is we assess whether these nationally determined contributions are child sensitive. What do I mean by being child sensitive? We look at whether the policies to support essential services for children are climate and disaster resilient, and whether policies are inclusive of children's rights, their participation, and their role as change agents. And I can preview today, I think without giving away the headline from the report, that in 167 countries where we assessed their NCDs, approximately 2/3 of those countries, the nationally determined contributions meaningfully reference children, but only a minority of those countries are judged to be truly child sensitive in terms of the policies they're pursuing. So there's progress, but there's more work to do. We do have various examples around the world of countries, I think, doing very bold and decisive things to make their child policies relevant and responsive to climate change. Maybe to name a few, in Argentina, they've passed a comprehensive environmental education law that equips the next generation with the skills they'll require for the climate era. And that's focused very much on inclusive of the early years. In India, they have disaster risk management plans that are, I think, very effectively child-centric. And despite, I think, many mistakes made during COVID, I think there was evidence of that, where the vaccine programs during the pandemic were maintained in India, where in other places they were put on hold. In Mongolia, there's social assistance programs targeted at children that are able to flex in response to shocks, which I think is a key example of a successful policy. And in Indonesia, there are community health workers who are teaching families about changing disease vectors. So when you look around the world, you can see, I think, some powerful examples which the US can learn from and emulate. So thank you for the opportunity to provide a testimony, and looking forward to hearing more from the task